Hi, and welcome to this course in Covidenomics. My name is Stephen King, and this is a course that's prepared for the Australian National University. So, what exactly is Covidenomics? To understand that, you need to recognise that I'm making this course starting in July 2020. Why does that matter? Well, let's have a look at a press conference from the World Health Organization from March 11, 2020.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
So, this video is being made at the beginning of July 2020, in the middle of a pandemic. How serious is it? Pretty serious. There's been around 10 million cases worldwide. About 5.5 million people have recovered, but just under 500,000 people have died. That leaves about 4 million active cases at the moment. The worst affected country has been the United States, with 2.6 million total cases at the moment. But one of the worrying aspects is a number of countries have rapidly rising infection rates, in particular India and Brazil. Here in Australia, where I'm making the video, we've had about 8,000 cases and low rates of new infections. However, in the last few days, there's been a spike up in those rates of new infections, particularly in Melbourne, where I'm making this video. Now, the disease at the centre of this pandemic is COVID-19, or the coronavirus disease. It's caused by a virus called the Severe Acute Respiratory Syndrome Coronavirus 2. Bit of a mouthful, SARS-CoV-2 for short, or even easier, COVID-19 virus. Now, in this course, we're going to look at the microeconomics of this pandemic. We're going to be looking at people's reactions, business reactions, and most importantly, the government public policy reactions. For this course, you need a knowledge of basic first-year university microeconomics. If you have any concerns about that, please go and have a bit of a look at the link on this slide. It goes through to a set of videos that I've made which present a first-year university microeconomics course. First off though, what is a pandemic? Well, pandemic is a large-scale outbreak of a new variant of an infectious disease that can greatly increase morbidity and mortality over a wide geographic area and cause significant economic, social and political disruption. You've probably already heard about some pandemics. Possibly the most famous one is the Black Death, or the bubonic plague, which killed around 75 to 200 million people in Europe, Asia and North Africa around 1350 AD. More recently, there was 1918 influenza pandemic, sometimes called Spanish flu. It infected around a third of the world's population and killed around 50 million people worldwide. So a first question really is, was the COVID-19 pandemic inevitable? To answer this question, it's worth thinking about the history of pandemics. Most pandemics are related to the influenza virus, or the flu. On this slide, we've got a list of the flu pandemics since the year 1700. They occur about every 35 years on average, and some are much more mild than others. For example, the 1957 and 1968 pandemics were much more mild than the 1918 one. There is some evidence that pandemics and flu pandemics are becoming more common. Part of that relates to international travel. There's much more international travel going on now, so it's much easier to spread a new virus worldwide. There's also more urbanisation now than at any time previously in history, and urban environments where people are clustered close together are great for pandemics, great for viruses to be spread. Another bit of information is that we've recently had a number of outbreaks of viruses that either became or could have become pandemics. Most notably, we've seen the coronavirus before. The SARS outbreak, or SARS coronavirus pandemic in 2002-2003 affected Asia. We've also had the Ebola virus in Africa in 2014 and the Zika virus in Africa in 2015 and 16. So it's not just influenza pandemics that we've been seeing in recent history. Further, some of these recent pandemics have been what we call zoonotic transmissions. They've come from animals and entered humans, often through the hunting and eating of wildlife. And in fact, SARS and Ebola were both zoonotic. So there's some evidence that these have been building up. So was the current pandemic inevitable? Probably. We didn't know which virus, we didn't know where it would come from. But it was going to hit us sometime. And hit us it has. The question now is, what do we do about it? Not just from a medical perspective, but from an economic perspective. And that's what this course is about.